were often frustrated by disease where we couldn't get sufficient radiation into the entire tumor just basically because of geometry. Being able to devise a device that would allow us to place radiation throughout whatever shape the tumor is. And it took quite a while to get funding for the printer. It was pretty obvious that we would have to use something like 3D printed technology. 7 years after we first thought of it, we treated our first patient. In cervix cancer, there are a couple of different protocols for how many brachytherapy fractions, like numbers of times a procedure is repeated. And the ones that are most commonly used here are either 4 fractions or 3 fractions. And delivering it in 3 fractions is often more challenging because it's harder to deliver the dose we want while protecting the normal organs nearby. And we have had several patients that using a cylinder has allowed us to get that difference between what we're doing to the tumor and delivering to the organs. And we've been able to move patients from a 4 fraction regime to a 3. We are working with colleagues in the other 3 brachytherapy centers, so that's Abbotsford, Vancouver, and Victoria, to enable them to be able to use this for their patients. Right now, if this sort of treatment is required, the women who require it have to travel to Kelowna. For instance, we have a patient being treated next week. She had our MR on Wednesday and her cylinders just finished printing. So we've treated 45 patients using custom printed cylinders in 5 years. The most rewarding thing I've done in my career.